Good afternoon, everybody. Thanks a million for joining us today for this Lunch and Learn webinar on Billink Remote Payments. My name is Donald O'Neill. I'm the head of marketing for Clonwilliam Health, and with me today I have Andrew Vadali, who a lot of you will already know as our account manager for Socrates. The goal of today's webinar is really to provide you with a demonstration of Billink and I suppose show you how it's going to make you easier for you to get paid. That's the ultimate goal with Billink, and that's everything that we've done and that the Billink team have done is to try and make it as easy as possible for patients to pay you. So what does Billink do? It lets you send a text directly from Socrates. That text contains a link to a secure payments page, which your patients can then click on and pay you. The money goes straight into your bank account, and it's all managed through Socrates. So look, we're aware that there are kind of other systems out there, but Billink is the only system that's fully integrated with Socrates, which means you can do this all from within Socrates. You never have to leave it. You get everything there. You can send reminders, you can send cancellations, you can send refunds, you can manage the entire remote payment process from within Socrates. So today, Andrew's going to walk you through this. He's going to show you how you can sign up, and he's going to show you how you can start using Billink to, again, make it easier for you to get paid. That's the ultimate goal here, and that's what we really want to get across with you guys. Billink is currently being rolled out, and you'll know you have it when you see the Billink icon in the top right hand corner of your Socrates screen. It's the blue B and Billink, the word there that you'll see on screen at the moment. And I suppose just a little bit of housekeeping for today. Andrew's going to do his demonstration, then we're going to take as many questions as we possibly can, because there's a huge amount of interest in this, and I can see this with the amount of you that have registered, the amount of you that are here online. Everybody kind of wants to have a look and wants to start using this as quickly as possible. So without further ado, sorry, just one more thing. If you do have a question, just on the right hand side of your screen, you'll see a little tab that says questions. Type your questions in there. They'll come to me directly, and I'll do my best to put as many of them as I can to Andrew at the end of the webinar. So without further ado, I'm going to pass the controls over to Andrew, and he's going to take you through a demonstration of Billink in Socrates. That should be on its way to you now, Andrew.
Thanks, Donald. Hi, guys. How's things? I hope you can all see my screen there. And as Donald said, we're introducing this new system. It's kind of something that people have been asking for quite some time, but it's now live and it's now ready to go, and it's actually quite nice. Just to kind of cover what I will go through. Obviously, I will show you how to register or bring you through the registration path. I will then show you how to add a charge from Socrates. It's something you already know. It's just that the Billink part of it is now extra on top of what's there. So it's quite nice. There's no separate windows. I'll show you then how to check payments that you've received or anything that's outstanding and go through your entire dashboard again, which is really, really interactive and really good. And then also finally your reporting. So whether it's your reporting for your end of day, end of week, end of month, etc. in Socrates, or there's an actual Billink report that you'll get at 5 a.m. every Monday morning to give you an update on how your transactions are and how what's outstanding, what's been paid, etc. And it's nice, lovely analytics on it, and it's eye-opening. I'll show you some of the bits when we get to it. So look I'm going to go ahead, because obviously I know you're all probably on your lunch. So you'll receive an update to Socrates in the next few days. As you do normally, it will come down overnight and it will update automatically. When you do receive the update, you'll find something new up here in your top right hand corner. So beside your home button, there will now be the Billink button. So the Billink button will be there. It'll be a constant. So regardless of what area in Socrates you're in, so if I navigate to appointments or reports, etc., this will remain constant. Also, the same button or the same link will be in here in the accounts tab on the left hand side, and you'll see Billink management, and you'll see this little icon, the B, as Donald was talking, the blue B around Socrates, and this will always indicate where you can make charges from or to visit your portal to check things out. So when you do get the upgrade, what you'll have to first do is register. So to register, very, very straightforward. Again, concentrate on your new option, your Billink, click into it, and once you click in, you'll come into your dash. Now, I've already registered. This is one I've prepared earlier. So for you guys to register, I have a little PowerPoint I'm just going to show it to you, but we have a document that outlines how to register, what to click, where to click. But very basically, if I just show you this, so when you go into your registration page, down here, you see where my really terrible looking red arrow is. There'll be a register account. Once you click that, you'll be able to pop in some information. and you just fill in practice name, contact name. Now, importantly, when it moves on from this, one, you'll have to check that you're a partner in your practice manager, or the principal GP. Two is that, and it's very, very, very important that you have this when going through the registration process, that you know your practice bank account, bank name and IBAN, just to have it, because you can get to a certain point, but you won't complete the registration until you have these details. Honestly, the registration should take you 5 minutes, if it takes you 5 minutes. Like, if you know this stuff off by heart, it will take you less. You can see here there's a summary, practice details, your details, and your bank details. I'm going to flick through each one. So there's a summary. You move on to practice details. So business type, partner, sole trader, practice name, etc., etc. Practice phone number, email, again, all very straightforward. If it's a practice website, you just pop in the link, copy and paste it, and you're good. If you're sole partner, or you're the sole principal GP or the manager, you put in your info here, it goes through. If there's then partners in the practice, each partner, first name and last name, and you can add as many partners as necessary. Then it goes on to the last part with your bank details. And like, there's no ridiculous forms or anything here. You put in your account name, your IBAN, and you have your T's and C's, and that's it. You're registered. And once your registration is complete, I'm going to close this. When you go back now to Socrates and you're at your home screen and you click on your Billink button, your dashboard will load up. So this is your Billink management dashboard, and this is the hub for all things to do with your transactions moving forward. So when I come in immediately, you can see here that I have some transactions. These are, as with Socrates, as when you go to any other area like bloods, drugs, etc., you have your between dates. So I can concentrate from the 1st to the 5th to the 17th to the 6th, or I can refine the dates. Again, very simply by a drop down. I'm on anything that's been sent. Sent means it's been sent out by you to the patient, a request for payment, but you haven't received payment yet. If I drop this down, I have paid. So these are payment requests to the patient that you have sent for payment that have been paid. And you can see here how much it is, when it was sent, who it was sent by, the date of birth of the patient, etc., what it's for. So again, and I'm going to show you how to follow up in detail on these in a moment. And then you have the cancel section, which shows you any actual Billink transaction or request that you sent to a patient that were cancelled for whatever reason. Maybe cancelled because it's a mistake. It may be cancelled because the patient walked to the door and gave you the money. There's lots of ways or lots of reasons why you may cancel, but certainly it's there if you need it. You also have a refresh button. So when I click refresh, it will refresh the page for us at any stage, or you have a synchronized payments button. So everything with Billink is really fast, and I mean this, everything. So whether it's the registration that takes 3 or 4 minutes, or when you charge the patient, which I'm going to do in a moment, and they pay you, the payment will be back. This area here, I think it syncs every 7 minutes. But if you're a bit more eager like me, you can click the synchronized payments button down here on the right hand side, and that will sync it immediately. So again, up to yourself. Or if you close the page and click back in, it will sync immediately. So I'm going to bring you through how to add a transaction, and then I'm going to come back in here, because this is the page here. It's the key place to be, and I'm going to show you then what all of these areas do over here. So I'm in the search history, and you can see here I have our colleague Donal, who owes me a few quid. But during this demonstration, our Donal is going to pay these, and we're going to see them vanish and sync as payments. So these are out, and I sent them this morning and one yesterday afternoon. So guys, I'm going to move out of here for a moment, and let's go on to our charging area and how to charge the patient and send them the request for payment. This isn't anything new. So whether you do your bulk of your charging from the waiting room, or if you do the bulk of your charging from the patient file. So again, I'm going to continue to use Donal. You can continue to charge as you do normally. The only difference is that I'm going to use the waiting room. If when I go into waiting room and I charge this patient, David Kennedy, and I click on his name here and go charge patient, now, because I've registered, I have my Billink option here, just under the amount. Right now, if you click that, when you don't have the update, you have everything that's on this window except for the Billink option. So it's quite nice, and you won't have this option until you register, so just to be aware of it. So I just go through my charging process as normal. I select my charge type, so I'm going to go consultation and bloods. The charge amount, which I can alter if necessary. I have additional notes, and this is quite important, I suppose. The additional notes can go up to 300 characters. So if you really want to add something in here, whatever it may be, and update the patient and have this note go with this particular charge, you can. Press save. Then, if I click send Billink invoice to patient, If they have a mobile phone number in their chart, it will automatically populate here. If not, you can just pop it in by going and then press save and close. Done. So what have I just done? I've charged this patient, David Kennedy, €75. And I'm just going to go back in, when I've clicked this, what it's done is automatically sent a text message to David Kennedy with that charge amount and with a link to be able to pay it. So obviously I can't show you my mobile phone because it'll be quite awkward, but I'm going to show you the payment option and I'm going to show you what they get. So I'm going to pop in to my, my Billink area. You can see here's the charge I just made to David Kennedy. And if I just go all the way over here to the end, do you see this little arrow? You can see what the transaction is. You can see how much it's for, but let's dig down deeper into that. So if I click this little arrow, it loads up your Billink portal and it allows you manage your transactions from here. So this is actually in Socrates, but this is your live website. This is your page. This is your own home. Nobody else can go here, but you can see that I've sent this patient, David Kennedy, his mobile number, the amount. This is the SMS message he received. So you can see it there. And I'm just going to put a copy here for a second. You can also see who his doctor is, when the payment was requested, sent by. You can resend it if it was sent for incorrectly. But down in the log, and this is going to be important in the moment, you're going to love this, is that you're going to be able to see if the patient has actually received it, if they have viewed it, if they haven't paid it, if they've viewed it multiple times. So what I'm going to do is I'm going to click out here for a moment, and I'm going to show you what the patient receives. So when I click in here and I have the link, and again, as I said, I don't have a mobile phone, but if you can imagine, this is the mobile phone. So patient receives a text message. On the text message will be, hello, David. Please find below a consultation for or a payment due for consultation bloods, service provided by your name or the surgery name. Here's the amount, other fees if applicable, and then if you have any questions, etc. What David does here is he's clicked a link in the text message, he gets this window, he clicks in here, pops in his card number. So I'm going to use my card. And probably you're all thinking this is not my credit card number, I promise. It's no good. It only works with our test version, as much as I'd like to go onto Amazon. Go in here, you pop in your email. The patient will then pop in their email address. The reason that the patient is putting in their email address is they will receive a receipt of payment to this address. Now, I'm agreeing to terms and conditions. Just before I pay, all of this information is not stored anywhere. This is all secure. It's not stored on Socrates. There's no reason for you to actually receive any credit card information or any other information that's listed here. This is simply for the patient to pay you through the secure Billink portal. Press pay, and it's going to register through and transaction complete. The patient then can move on to whatever else they're doing with their day. And when you come back, if I'm just going to close out and I'm going to go back in, and it'll sync up, and you can see there, it's no longer in sent. When I go down to paid, it's paid. And literally, that's the live system. I might be on a test credit card and a text transaction, but that's it. That's as quick as it gets done. So if a patient has received the text, they can literally click on it and pay you immediately. Now, I'm going to show you a couple that I sent to Donal, just to give you an idea of what you can see. And it's not just a payment system, it's an interactive system that allows you to, one, send the request for the transaction, but also to keep an eye on it and to be also able to audit and let somebody know that they have received it if they've been looking at it. So when I go in here, press this little arrow again, this is a transaction I sent Donal. Donal and I have been working on it. You can see down here in the log part of it that the initial request was sent earlier today, but Donal has viewed the payment page multiple times and only made the payment then on the 7th or 6th time that he tried. So
I
again,
wasn't sure if I was going to pay you, Andrew. That was it, you know.
yeah, look, it's a lot of people like that.
But I think the important thing is it removes the option for the patient to say, "Oh, I never got that," because you know they've gotten it. It's guaranteed. It's proven that they've got it and they've clicked on the link. You know.
Exactly, and it's key to it because again, look, guys, we all know someone will say, "Oh, I didn't receive it," or "That's my right mobile number." Immediately, you'll know if they received it, if they've been viewing it, or let's say he did pay me and I need to refund it because it's incorrect. I can go in here and refund it directly from here by clicking refund. I give my reason because obviously you guys are going to be running your reports and knowing why. Press refund, but hopefully you won't have to do this too many times. Done, and this then brings you back to your interactive dashboard. So I can go in here and view any transaction the same way. So you can see here, Donal, DEXA scan, paid. Go in and view it. It brings me through all the information about the initial charge, what it was for, the text message, and then the log as to who's viewed it, if they viewed it. If then I go back to my dashboard, I can see who's paid, I can see the dates they've paid, lining it all up all along. I can use my area over here on the left, my navigation, to go into the portal again at any stage. So when I go into portal, this doesn't give me just a list of the transactions. This literally gives me, this is our interactive portal for our surgery. So practice name, um, who's the owner, name of the account, etc., all the email addresses associated. I'll go into the practice image in a moment, but you can see your current balance that's pending. So I know that I've been paid €1,083.92. And I know that obviously I'm going to talk about charges in a moment, but I know that this is what will be transferred into my account in the next, say, 24 hours or 36 hours or however I choose. So when the patient pays you, the account comes straight back into Socrates, the fee comes straight back in and says, right, goes against the charge in the account and says that's paid, and then you receive the fees, then the total number of fees, say daily or every 3 days or whatever you would choose as a surgery. So for example, over say from a Monday to a Wednesday, if you got paid €1,000 on the Wednesday evening, that would then be transferred into your bank account and it would be there waiting for you. Also, you can see here what the text message that the patient receives, how it's structured, what it says, and you can switch on your 24-hour reminders. So this is lovely. So if you send a text to me or you request a payment and the text message was sent yesterday at 9 o'clock, 24 hours on the dot, if I haven't paid it, you can switch this on, and this is for all, and they will receive a reminder text message. That again, so just in case, you know yourself, you look at your messages and you would continue on with your day, but certainly it helps if they get a reminder text the next day to jog the hours or jog the memory. And you'll see as well from the report I'll show you in a few minutes that this is quite good, and it helps to kind of nudge the patient through to payment. Also, you can see the practice image. I have Clown William in here, and very quickly, if I just drag in, say you want to put in a separate image, you want to put in a picture of the surgery, whatever, if you drag and drop, it will update that. So now when you send a transaction request or a charge request to a patient, they'll see that image. So again, if it's Christmas, you want to put in a Christmas image, whatever you want, it's up to yourselves. But certainly you can keep going back here, keeping an eye on what's going on and what's updated. And even if I go back into my waiting room now, you can see here, as we all know, the dreaded balance at the end of the patient's area in the waiting room has now cleared. It was €75 before I put that payment through. So that's how quick it is. There's no messing around here. There's no taking credit card numbers over the phone. There's no need to have a button on your website for patient payment. You literally control everything from here, from the waiting room, or as I said, from the patient's file, consultation, charge patient, or if you prefer, if you go into the patient account area where I am with Donal, and I'm coming in here purposely, guys, you can see that all the transactions, but they're broken down. Standard consultation, but the payments are online payment, online payment. If there was cash, it would say cash payment. So it's very easy to define what's come in online and what hasn't. Now, let's say, for instance, I've charged Donal a few times, and you can see Donal has an €835 outstanding balance with me. And let's say this is historical. Let's say these are over the last 12 months, but I want to send him one text message with the charges and get him to pay them all, because he says he will, he just can't get to the surgery. So I highlight them all. Billing group charges over here on the left-hand side. Sorry, that's me, of course. Payments, charges. There you go. I only want the outstanding. So there's the outstanding ones. I can send all together. Press save, and now Donal is going to receive a text message with a link, and he can pay for all of those outstanding charges at some stage. Now, it's quite nice, it's quite interactive, and you don't have to have it open constantly. Like anything else in Socrates, you can go in, you can close it, you can work away, and you can go back in to home, to drugs, do whatever you have to do, but click into your dash at any stage and have an idea of who was charged, what's outstanding for today. So like the prime examples for these are if someone is prescription charged, so someone has rang in for their script or they've ordered it online or whatever it may be, you can go into their file immediately or into the waiting room, wherever it may be, consultation, charge patient, say, okay, I'm going to charge them whatever it may be, prescription charge, send it, job done. The patient literally 3 seconds later will have that text message and they'll be able to pay that, and then you'll be able to keep an eye on it. And once this balance is paid, you can then go in and you can see that's at zero or it's in paid. You can then send the prescription down to the pharmacy. And it's been quite nice. You can see a lot of this stuff is coming through, and the prescription and the prescription type charges and charges like that that have been used are great. Now, as we move on to it, you can see that you have certain areas over here. You have transactions if you want to break them down to transactions only. So again, you can see it here, and then payments only. So again, this goes into your interactive dashboard as opposed to just being in the Socrates dashboard. And you can see here then I have my transactions broken down, but anytime I want to go back, I can click on my search history and I'm back to my portal as per usual. Now, as mentioned previously, each patient, every time they pay, will automatically receive a receipt. So I've spoken to people previously and they were telling me that the pain they had to go through about getting receipts to patients if they rang in and called out credit card numbers over the phone, like some were even putting a stamp on a letter and putting the receipt into it. There's none of that. You just click in. Once the patient pays you, an automatic receipt will go to the patient into their email address. Job done. You don't have to do anything else. So look, I've shown you how to charge. I've shown you how the patient or the payment come in, and I'll do one more just so that we know. So if I click in here, and again, as I said, I don't have a mobile phone, but I am able to access it. And I go in here, I'm going to use this link. And as I pop it in, the patient will literally click on the link. They'll pop in their credit card number.
And here, Andrew, I think it's important as well to point out the image that you changed earlier has already kind of instantly updated on the payment page. And what we've seen in early feedback is just a photo of the practice can help people realize that this is secure, it's legitimate, it's safe for them to pay you via this link. So that's
Yeah.
again another way of kind of saying that you are who you say you are.
Exactly. And just to reiterate, no credit card information is saved here. When I press pay, that's it. Transaction is complete. Surgery receives confirmation the payment has been made when I go back into the portal. And then afterwards, like if I just synchronize here, it'll sync in a second and you can see that's it. Job done. Paid. And it's actually really, really slick. Now, okay, so we've gone through the transaction part. We've gone through adding the charge, receiving the payment, showing you the dashboard, and you'll have a lot of fun kind of keeping an eye on this. And I suppose the main question is, what are the fees associated with Blink, and what are the charges? So to very basically tell to point those out, there's two types of fee. One fee, or the kind of set fee, is anything from €1 up to €20 is 89 cents per transaction. That's it. Job done. Anything €20 plus is 3.25% of the transaction. So to break that down for you, if you charge a patient, say, €50, it's 162 of that €50 to send it via Blink and to receive the payment. If the patient doesn't pay you, you don't pay anything. There's no transaction fee. There's no monthly fee, so your support's not going up. There's no registration fee. There's no card terminal. There's no annual fee associated with Blink. If you use it, there's fees associated. It's per transaction. So what you pay to use Blink will only be based on the kind of transactions that you were doing and the payments that you're receiving. But if you don't, then for some reason don't use it, there's no charges. There's no additional charges on top of that. But to be totally honest with you, we all know what we're going through at the moment in regard to taking payments over the phone, credit card numbers, etc., even staff time. And I'm going to show you a couple of reports now, but the beauty of this is that I can send this transaction or this request for payment at 12:55 today, and this patient might pay me at 10 p.m. But it will still come back in. It'll come back into Socrates. It'll be there in the morning when I go in, and when I go down here to my report, and I go to my accounting report, total surgery income, as we do every day or whenever we do these reports, I'm going to go back a few days I'm going to run it. I can see here my summary. I have one cash payment of 55. I have a few online payments. I'm doing well. And then when I scroll down, there's a breakdown of all of my charges and all of my payments, and whether they're online payments, cash payments, or whatever they may be. So this links in with your end of day report. It links in with everything that's there. If there's a credit card payment from a machine, or if there's, say, again, we don't have a lot of patients on site, so it's hard for that. If there's a check, it'll say check. Again, everything as per normal with Socrates will be there. Also, and as I mentioned earlier, once a week you'll get this it's really nice, and it's a really slick report directly from Blink. And when it comes in, it will give you your practice information. It'll give you the dates to and from when it's running, but also it'll give you how many transaction requests or payment requests you've sent, how many have been paid. 24-hour reminders, have you got them on, yes or no? Again, some surgeries may not have them turned on and be like, wow, we need to get that on. 7-day reminders. So again, if something's gone 7 days older, they will also get a text automatically if you'd like. and the 28 days. Practice network success average was 99%, so that's good. We're sending and receiving all of our payments. Estimated administrative time saved. This is quite nice because this is based on the number of transactions that you come through, and it adds a kind of value in minutes to it, and it adds it up for you. What's outstanding? And what's due for payment. So again, you can see here, I have what's outstanding, Tom Thumb and Al Bundy and Fred Flintstone, never pay me. And as I scroll down, this is actually quite nice on the second page. This is something that you can see yourself kind of looking at and waiting for every week. You can see the payments out of hours. So you can see that outside of your hours, what time charges were made internally, and then when things were paid, and you can see if they were paid during working hours or outside of working hours. Like even the likes of myself, as I speak to you right now, my phone in the background is hopping away, getting texts and emails through things that I will deal with now for work, but also most of the personal stuff I'll reply to in the evening. And then this will update as time goes on. Like this entire thing was based on requests coming in from our current users. And this is the beauty of working with Billink, is that it's not just a payment service. It's not just, it's all of this on top of it, is that all of these different transactions, all of these different reports, and the link into Socrates, the most important part of it, is all there. And if things should change or they need to change, that we have a direct line to Billink and we have direct interaction with them, that the guys will implement the required changes when necessary. I'll give you 2 bits before I let you on to Donal. We had feedback initially that when we were at the charge window, so when I went to charge a patient, you could only charge up to a certain point. We capped it at 999 because we thought, God, who'd be going over that? It actually turned out that there was someone going over that because there was a lot of outstanding transactions. So that was increased that day. Secondly, the notes section, when you go to add the charge, was capped, I think, at 50 characters in here. That was increased yesterday to 300. These things are all based on feedback, the report based on feedback, and it's the likes of this that we can add to and increase as time goes on. A couple of little things, sorry, now I'm going to pop into Donal, is that just it will be live. Everyone will be getting the update. If you don't have the update on Monday, you'll have a Tuesday, Wednesday, or Thursday. We're rolling them out overnight, about 100 sites a night or more. So look, at if you want to get updated immediately and you really say, look, I want to crack on using this, give the guys in support a call and they'll pop you to the top of the list. Sorry now, Donal, I know I've gone on over time, but
No, you're grand.
please, any questions or any feedback?
No, there's a lot there, Andrew. And look, I hope that everybody has gotten the impression of how easy it is to use. I think that this is the ultimate goal of it's completely integrated with Socrates and it's easy to use and it should save you time and make your lives easier. That's really what we wanted to do here. And certainly the feedback from the sites who are using it and the pilot sites, it has been phenomenal in terms of it's a game changer and it's saving them time and making it easier to get paid. So look, thanks Margaret for your sympathies there about all the charges Andrew's sending me. He's very expensive. But also we had a question in just around consent and patient consent on text messages. And sorry, the question is, does a patient have to consent to receive the text message? I think this will vary by practice and it will depend on what kind of consent you have captured when you've taken the patient mobile number. But I would
Exactly.
say the best practice when you are sending a Blink is to say it to the patient. So to say, I'm going to send you this charge by text message. You'll get a text through now with a link, a secure link to pay you, to pay us. It's completely secure. Click on the link, enter your credit card details, and that's you done. You don't need to worry about it, and you'll get an invoice. Just to make them kind of aware that it's coming, and I think that will get you past any consent issues. But I would say that consent needs to be kind of gotten at the point where you're taking the mobile number. So
Yep.
again, even if you didn't have their mobile number, but you were taking it and saying, look, I'm taking your mobile number because I'm going to send you a text message, and that should hopefully get you around anything on it.
Well, we all
Um,
know at the moment in
one more
Socrates,
question.
sorry, Donald, when you put in the mobile number, there is an SMS consent area. So it doesn't say only SMS with content of X. So this was done originally based on this so that you can send them a text in that contains anything, including the Blink information and ask for the payment. Again, it's up to the patient whether they act on that then afterwards or not. As with everything, as with even the appointment alerts, they may choose not to receive it and then you can't send them a text. But again, most patients, it's, let's put it this way, you're not a marketing company, you're one of the most important aspects of their life, and so they will need to receive these texts from you. But certainly you can go in here and click yes once you put in their number, save, and that means they've consented to all texts from the practice.
Yeah, yeah. And sorry, we just had another question in there very quickly. I'm conscious that everyone is kind of on their lunch as well. So it was just a question around the text message charge, Andrew, and that
Sure.
is on top of the percentages, or yeah, it is,
It
isn't
is.
it?
Apologies, guys. Yeah, I should have covered that. So when you go in here to your, if I go into our portal, just to show you. So as I said, the percentage. So if you charge the patient €50, it's 162, but there will be an 8 cent charge also for each text message. So each blink you send to a patient will be 8 cents, regardless if they pay you or not. But if you can imagine, if it's 162 for the blink part, add the 8 cent to that, that's 170. If it's say €100 charge and the charge is 325, add your 8 cent, it's 333, which is quite nice, all the threes. But yeah, there's an 8 cent text charge, but the text is great and it's super fast, as in 3 seconds. And we've tested this a few times because we understand that people are conscious about, oh, when will somebody receive it? So if they receive send the text immediately, they will receive it, and then it's up to them. But as I said, in here you can track, but it's 8 cent for the text, and then it's 3.25% of any transaction from €20 up, and 89 cent for any transaction from €1 up to €20. Obviously not a euro.
Excellent. Look, Andrew, that was brilliant. I hope that everybody has gotten a real kind of clear overview, and I think everybody should have. What I would say to you is, genuinely, we're excited about this from the Clan William Health side, because we really see it as a game changer for you guys, and we would encourage everybody to try it out and see how you can slot it in as part of your kind of standard processes. And we're really confident that it's going to actually just improve things, make it easier for you. So as Andrew said, it's being rolled out at the minute. You'll know you have it when you see the Blink logo in the top right hand side of your screen. Click on that, it'll bring you through the onboarding. Again, as Andrew said, onboarding will take you less than 5 minutes, and you can start using it then. And you can send out test ones to other staff, or you can actually just go and send it to patients. Genuinely, we do believe that this is going to make your lives easier, and we're really excited about it. We hope you are too. And again, we know it's something that you've all been kind of asking for, and I think it's a really nice development to add to the Socrates system. So look, on that note, I won't keep you all any longer, but I'd just like to say a huge thanks to Andrew for kind of walking us through that. Thanks to everyone for attending. If you do have any questions, or if you do want to get it switched on earlier, or bump yourself to the top of the list, please do drop myself or Andrew an email, and we can arrange for you to get it as soon as we possibly can. So look, thanks very much, everybody, and I hope you have a great rest of your day. And thanks again, Andrew, for running us through that. Bye bye.
Thanks, guys. Take care. Bye bye.